Hi everyone, I'm Sandy and I chose magnesium sulfate for my research to learn more about it as I actually have personal experience with this drug. During my 28th week of pregnancy, I was diagnosed with gestational diabetes following a glucose tolerance test and was referred to a high-risk obstetric specialist as a result. During my 33-week checkup with that doctor, I was attached to the fetal monitoring machine and the nurses informed me that I was having contractions. I was not feeling contractions in the least, mind you, and I informed them of that. Nevertheless, they admitted me to the hospital anyway on the afternoon before my 30th birthday. That was on a Thursday. They told me to prepare for the fact that I was probably going to have my baby that weekend and put me on a 48-hour IV drip of magnesium sulfate. My son was born on Sunday morning at 1:50 a.m. via an emergency cesarean section because his heart rate dropped and he had a lack of movement on the ultrasound. He was born at 33 weeks, 6 days, and he spent the first 3 weeks of his life in the NICU. And thankfully now he is very healthy. He has been since he was born, and he's growing nicely and thriving. So what is magnesium sulfate? It's actually a very versatile compound that can be used as an anticonvulsant and a tocolytic agent, which means to halt preterm labor. And it's used that way when it's administered intramuscularly or intravenously. It's a fast-acting laxative when taken by mouth, and it's an anti-inflammatory when applied locally. And in that latter form, it's also known as Epsom salt. And I had heard of Epsom salt and even seen it before, but never actually really knew what it was. And the tocolytic agent is the aspect that I'll be concentrating more on, as that was what I was interested in learning about. The leading cause of neonatal mortality is actually preterm birth, which is defined as birth between 20 weeks and 36 weeks gestation. As such, it's the most common reason for hospitalization of the mother prior to the due date. And according to the American College of Obstetrics and Gynecology, less than 10% of women with the clinical doses of preterm labor actually give birth within 7 days of presentation. The use of tocolytic drugs to inhibit uterine contractions and prolong pregnancy is one possible pharmacological prescription. One of the agents currently correlated with an improved neonatal outcome is actually magnesium sulfate. And it is currently not known exactly how magnesium sulfate halts preterm labor, but the prevailing justification is that since calcium is required for muscle contraction, it is theorized that uterine muscle cells relax as a result of the magnesium lowering the calcium in the uterine muscle cells. It has been shown to be an effective way to slow contractions, though it varies from woman to woman and has not actually been proven to delay or prevent preterm labor more often than not. Magnesium sulfate causes some side effects, including headache, nausea, blurred vision, dry mouth, flushing, feeling uncomfortably warm, and exhaustion in generally half of the women that are treated with this drug. If it's administered in high doses, respiratory failure and cardiac arrest may result, and one of the signs that doctors actually look for is the loss of the knee-jerk reflex. Fortunately, if levels reach an undesirably high level, the effects can be reduced with administration of calcium gluconate. Since magnesium sulfate relaxes many muscles, babies may be floppy or listless at birth, that if they've been exposed to the drug for an extended period of time. But thankfully, when the drug has been eliminated from the baby's body, once it's had time to do that, those effects generally go away. The FDA has actually assigned magnesium sulfate to pregnancy category D. What does that mean? Well, according to the FDA, it should be noted that pregnancy category D means there is a positive evidence of human fetal risk, but the potential benefits from using the drug in pregnant women may be acceptable in certain situations despite the risks. If the mother receives intravenous magnesium sulfate for longer than 24 hours prior to delivery, newborns may experience and show signs of magnesium toxicity, such as respiratory and or neuromuscular depression. As a precaution, it is recommended that equipment be available for the first 24 to 48 hours following delivery for assisted ventilation and intravenous calcium should the need arise. In a safety announcement from the FDA, dated May 30th, 2013, it is stated that it is unknown what the shortest duration of treatment with magnesium sulfate is that results from harm to the baby. And it is actually now advised that healthcare professionals do not use magnesium sulfate to stop preterm labor for more than 5 to 7 days, as this particular use of the drug is off-label. And that means that the FDA has not approved the drug to be used in that way. It's believed that magnesium sulfate administration for that amount of time may actually result in low calcium levels and bone problems in the developing baby. It's, however, approved to control and prevent seizures in preeclampsia and eclampsia. Pregnant women are advised to discuss the possibility of going into preterm labor and the benefits and risks of using that treatment with their doctors. If healthcare professionals are administering magnesium sulfate to pregnant women, they should be informing their patients of the potential harm to the baby, though. The FDA advises that magnesium sulfate should only be administered during pregnancy when absolutely necessary. My husband and I have had many unanswered questions since our experience, and do still, even after I've discovered all this information. If less than 10% of women are actually giving birth before, the due date, and I wasn't feeling contractions, why intervene? If I knew then what I know now, I really wouldn't have given my consent to have them administer the magnesium sulfate. I would have requested them to simply monitor me and the baby for a day or so first. When I was admitted to the hospital and receiving the IV, I was informed that I was on bed rest and not to get out of bed. I was told I would have a catheter to drain my bladder, as the magnesium would relax my muscles so much that I would not be able to make it out of bed and to the bathroom safely. If I had been in the mindset to fully comprehend what was going on, I would have asked them what the effect of the magnesium would have had on my baby. It was not informed to me at all, however. I wasn't informed of any risk to me or the baby. I really wasn't informed of much at all. And honestly, I felt fine and wasn't aware of any muscle weakness that would have prevented me from making it out of bed into the bathroom safely. My baby, however, had a lack of movement and decreased heart rate according to the fetal monitoring machine and the ultrasound, and that was a result of how the magnesium affected him. In my opinion, using that drug on me was not worth the risks that were not actually explained to me anyway. And the purpose of administering this drug was to stop the preterm labor, but the end result was a preterm emergency cesarean anyway. So my greatest question is why they couldn't have just monitored me and the baby. If he was going to be born prematurely anyway, I would have preferred that labor be allowed to progress naturally, and obviously it would be under the supervision of the high-risk specialist, as opposed to exposing myself and my baby to that unnecessary drug. Up to that point, I had always felt that you should trust your doctors. They know what they're doing, and they'll take care of you. You shouldn't need to question your doctors. They should be informing you of what's actually going on and any risks that you may be experiencing, and if you're a pregnant woman, what your baby may be experiencing as well. Since then, I have come to the realization that not all doctors are created equal, and it is always a good idea to be proactive in your own medical care, and asking questions whether to probe for deeper understanding or to determine if there are alternative options should always be part of every conversation. So that's my research, and thanks for listening, and I hope you learned as much as I did.